Good afternoon, everyone. I'm Rafael Lopez, Communications Specialist for Advent Health West Florida Division. And today I am joined by Dr. Doug Ross, Chief Medical Officer at Advent Health Tampa. Before we get to Dr. Doug, today we will be talking about some of the most prevalent questions our team members are getting about COVID-19, the new Delta variant, and new CDC guidelines and recommendations. I'd like to welcome all of those watching to please submit your questions in the inbox chat, and we'll be sure to answer those at the very end of this conversation. Dr. Doug, thanks so much for joining us today. Let's get right to the numbers. Florida continues to break records in the number of COVID-19 hospitalizations, and Advent Health Tampa, which happens to be the largest hospital in the West Florida division, is also seeing a surge. So break down the numbers of how many folks you're seeing right now in the hospital and how that compares to the surge of 2020.
Well, thank you, Rafael, for having me on today. I appreciate it. So across our 6 hospitals in Tampa Bay region, we're well over 300 patients now. That is exceeding our past surges entirely, and it is continuing to grow. Greater than 90% of those patients are unvaccinated, so greater than 90% unvaccinated, and our numbers continue to grow.
You talk about 90% of the patients being unvaccinated. Does that demographic change in comparison to last year? Are we seeing a difference in the audience that's coming into the hospital now?
Well, to your point there, obviously we didn't have the vaccine before, and more of the unvaccinated are younger patients. So we are seeing a younger sort of variability, but we do see it can be seen as young as 16 or 14 years of age. Even we've had a baby who has had COVID. All the way up into the 90s, but really the shift has been towards younger people because those are the people who have opted not to get vaccinated, and so that's what we're seeing.
And what are some of the symptoms that these patients are coming in with?
Well, it's the usual symptoms. Honestly, it's a little bit more severe, I would say, in terms of the symptomatology, the oxygen requirements, patients' lungs not functioning adequately, so they're short of breath. And then, of course, they have the flu-like, or what I would call flu-like symptoms of nasal congestion, headache, cough, runny nose. Some are losing taste and smell. There's some debate as to whether the Delta variant causes as much loss of taste and smell as did the earlier types of COVID. But mainly it's pulmonary problems, to say the least, that's requiring patients to be admitted to the hospital.
You talk about the Delta variant, now the most prominent variant in the state of Florida and overall in the country. Break down what exactly is the Delta variant and why it is more transmissible.
Well, let me explain that really ongoing as the virus continues to spread and go into different bodies, there are changes in the RNA structure, the RNA messaging that occasionally occur just really sort of out of error. And those errors either make the virus, doesn't change the quality of the virus, or it makes it stronger in terms of its ability to do certain things, and it may make it weaker to do other things. So a genetic variant that causes it to get weaker, actually that variant doesn't survive. But a variant that actually makes it more likely to be transmissible, more infectious, or more severe, those will survive. And actually, that's what's happened to the Delta variant. The Delta variant now has created certain variations in the original COVID virus that makes it even more contagious. Actually, it is probably tied with some of the most contagious viruses we've ever known. Measles and chickenpox being examples of that. And now that's very concerning because the amount of spread that is occurring is so much greater, from one patient spreading it to 2 or 3 patients to the earliest COVID cases. Now it's somewhere on the order of 8 to 10 patients for every one patient. it's spreading to 8 to 10 people, which makes it spread to a lot more people. The variations also in its ability to permeate into the cells of human beings has been improved on the Delta variant. Improved, I say it in a scientific fashion, not really improved on a good fashion. As a virus is able to penetrate the human cell, that's when the virus then takes over pretty much the functioning of that cell, and it actually causes the cell to start churning out more copies of the virus. And then lastly, there's the viral load seems to be so much greater in Delta variant, probably 1,000 times greater in the respiratory tract, the amount of virus that sits in the respiratory tract when you're infected. And so that means when you cough or sneeze or whatever, there's a lot more virus that's being let out into into your surroundings, and makes it more likely that other people will pick up that virus.
I know that you and I have had the chance to talk about COVID-19 a couple times, and you shared with me that the most effective way to fight COVID-19 is the vaccine. So, for those who are still hesitant and are unvaccinated, explain to them why they could still benefit, especially now with the Delta variant. But you've mentioned there are other variants that are slowly getting into the country as well.
Well, there's a lot of reasons to get the vaccine. One of the strongest reasons is to protect yourself against getting this Delta variant, which can be pretty devastating. And as we had just said, the people who are getting this and needing hospitalization are people who are not immunized. So that's a very strong reason, in my opinion, to get immunized, because you will have a lot less severity if you're immunized and you get the Delta variant than if you didn't have an immunization. So that to me is a really compelling argument. The other argument that there is out there is that you want to protect other people. There is a certain sense of community that I think we need to appeal to people on, because as we reach herd immunity, we actually are protecting people that can't protect themselves. In other words, people who are who have not a well-functioning immune system cannot, even with getting the vaccine, mount enough immunity to protect themselves against the infection. And then we also have a large population of children, 12 and under, who cannot get the vaccine yet, who could be infected by anybody else who has the virus and cause illness for those people as well. So there's that reason as well. And then the last reason, and there are more reasons than just three, but the last one I would prioritize is that if we don't get control of this virus and it's continuing to mutate, there is some fear out in the scientific community that that this virus could mutate to a point that it actually beats the vaccines. It comes to a point where it mutates in such a way that the vaccine is no longer effective to the virus. And then we are back to really square one with the entire population, because no one will be immune to that variant.
You mentioned the vaccine. Besides that, should folks be wearing a mask right now? And what other recommendations do you have for folks that are vaccinated and unvaccinated?
So what I would say to that is that yes, I really agree with the CDC that patients, not patients, everyone in indoor spaces that are whether it be going to the grocery store or wherever, should be wearing masks indoors for sure, to both protect themselves from getting the infection and from spreading the infection themselves. So that is very important. And in fact, it's been shown that patients who've been or people who've been immunized still can get infected. They may be staying, asymptomatic. They may not even know they're infected and yet be able to spread it. So that's one reason to wear the mask, is to protect others if you do have an infection that you're not aware of. And the other reason is to protect yourself from getting it. And then there's the usual other things we need to do, which is social distancing, to maintain distance so that if the virus is around, that you don't get from another person, that you're far enough away that it doesn't spread to you, as well as washing your hands, because you come in contact with so many different items that could have virus on it, and try to avoid spaces that are indoor spaces with a lot of people.
Dr. Doug, it's no surprise that the last year has been an emotional roller coaster for everyone, and frontline workers aren't the exception. It's been very emotionally draining and physically because of all of the patients that they've treated over the last year with COVID-19, and they do it with so much grace. What are you hearing now with this latest surge? Are team members concerned as they were last year?
Oh, yes. Well, first of all, we've gone through two surges. We thought we were out of the, we thought we were sort of improving and getting better, and things were calming down. I mean, that's a bit of the challenge in and of itself, is that now all of a sudden, when we thought we were getting a handle on this whole thing, we have a surge, and a surge bigger than any surge we've had so far. And so that really has been a challenge emotionally to people, because people were a little bit celebratory, I would say, in their own minds, that they had gotten through the worst of COVID, and that's just not the case. Our staff are very dedicated. Our nurses, doctors, respiratory therapists are very dedicated. But in fact, we're all a bit frustrated because of the fact that if more of a population had been vaccinated, we wouldn't have been seeing this surge, and we wouldn't be stressing our health systems out. And that actually leads me to the fourth reason to be wearing a mask, which was one of the early reasons to wear a mask, was to sort of dampen the curve, the rate of increase of the viral spread, so that it wouldn't put a strain on our health systems. And if this continues to rise the way it's rising, it most definitely is putting, and will continue to put, a significant strain on our health systems. So, we're ready to take care of patients. We are taking care of patients, but there's certainly a fair amount of fatigue associated with this ongoing pandemic.
Before we open up questions from the audience, I do want to make a quick point that our emergency rooms throughout the West Florida division are getting full. So we want to encourage the community to connect with their primary care physician, do a virtual visit, or go to the central care location within the West Florida division. Advent Health, what makes it very unique from other healthcare systems across the country is that it's a very vast network where folks can get care all throughout our community. Let's open up to questions here. The first one is, how exactly are we testing for these variants, and what types of testing are they showing?
So that's a very good question. At least, as I spoke to before, the Advent Health Central Division works very closely with the public health departments to actually scan certain amount of testing to see, and the public health departments actually are doing the typing of the variants. We're not doing that work locally. And the same thing is true for us here on the western side. They Health departments are monitoring, and doing random sort of testing to see what variant is predominating, and if there are any new variants occurring that are to be of concern. And certainly the Delta variant is, we're at 95, 96% at least Delta variant, because it's just such an infectious variant.
Other question we have here, I know a rise in deaths usually lags behind rising case and hospitalization numbers. Should we be concerned about seeing more deaths from COVID-19 during this surge, or does having the vaccine change that?
It's also a very good question. And, I believe that it's been shown that the Delta variant has actually a worse effect on survival overall. But the difference is going to be sort of in percentages. That's the sort of the confusing aspect of this. If you can figure that the whole 50%, let's just say, and it's not exactly true, that 50% of the population is vaccinated, and if you count those vaccinated people in the calculation of how many people have the Delta variant, the percentage of deaths, because they're only going to happen in those patients who've not been vaccinated, the rate actually of mortality might look lower than it did actually when we had no vaccine at all. But it is sort of tricky. So you want to look at the mortality rate of the unvaccinated only. And we're not sure yet, but we are thinking that it will be higher than what we've seen in other COVID variants.
Other question that we have here, Dr. Doug, is as we learned more about the virus last year, we heard that fewer patients needed the ICU, needed to be in the ICU or a ventilator. Is that still the case?
Another very good question. We have that is right now the case in terms of the number of patients that we have seen that need ICU level care. Of course, we are still using the medications that we have been using all along, which has had some success in reducing the number of critical care requirements for patients as well as for ventilators. So yes, we continue to use those strategies, and yes, that is helping us keep patients out of the ICU, and so that's good news. Yeah.
Another question. So, for some context first, there's a lot of vaccine hesitancy, especially amongst folks with pre-existing conditions. So the next question that comes in, Dr. Doug, is can you get the vaccine if you have hepatitis C?
You should be able to get the vaccine. I would encourage you to see your own primary care doctor, but there really shouldn't be a contraindication to getting the vaccine with hepatitis C. Again, you might be somewhat slightly immunosuppressed, and the effectiveness of that would have to be weighed. So I encourage you to see your doctor and ask them your advice.
So we have no more questions. Thank you, Dr. Doug, for answering those. But before we end, is there anything else that you'd like to add? Any message to the community before we end this conversation today?
Well, I would just like to really echo that we're very concerned in what's going on in the community. We are here to serve the community. We're prepared, and we are serving our community. It's frustrating that we've had an option of vaccination, and I understand people's reticence, but when you look at the risks and benefit ratios of having the vaccine versus not, I think the evidence is clear that the vaccine helps prevent you from getting severe disease, and that you really should take this opportunity to get vaccinated. I'm kind of comforted in a way that we are seeing across the United States an increased interest in getting vaccinated. I would encourage people to be vaccinated. The other thing is, again, social distancing, wearing masks, washing your hands is very important in trying to reduce the spread or the speed at which this disease is spreading, so that we're able to not overwhelm our health system. And we're very grateful to everyone who actually has come on today, really, because I think everyone is concerned to hear how we can try to slow things down or, in fact, eliminate it. And it would be really great at some point to have this as just one aspect of our care system, and not have it be such a prominent part of our lives.
Well, Dr. Doug, thank you so much for joining us. We really, really appreciate all of the efforts you and all of our frontline workers within Advent Health are doing to guide our community. For all of you watching, thank you so much. If you have any additional questions, please feel free to leave them in any of our inboxes across our social media platforms. Thank you so much, and take care.
Thank you, Rafael.